Hi, and welcome to the fourth and final video review of laryngeal anatomy. This picks up from our last video where we were discussing the intrinsic muscles of the larynx, and this is a nice summary image that shows us the various actions of the intrinsic muscles. And I'm just going to use just some initials here to point out the different actions. These actions of this arrows toward, which pull on the arytenoids causing abduction as actions of the posterior cricoretinoid, whereas with the true antagonist of that, which is the lateral cricoretinoid, which pulls in the other direction, the muscle that brings the two arytenoids closer together is the interarytenoid, or sometimes just called the arytenoid muscle. The muscle that helps bring the vocal process closer to the angle of the thyroid is the thyroarytenoid muscle. And then this arrow here, which symbolizes the pulling or rotating of the thyroid about the cricoid, is the action of the cricothyroid muscle. So it's important and helpful to keep those in mind as you're studying your voice disorders, and particularly those related to neurologic dysfunction. Now, as I mentioned before, we have what's referred to as the supplemental and extrinsic laryngeal muscles. These muscles' primary job is to position the larynx in the neck itself rather than positioning structures within the larynx. So you may elevate or depress the entire hyolaryngeal complex with differential action of these muscles. Functionally, they often divide these into what were referred to as the suprahyoid muscles, or those are muscles that attach to sites above the hyoid bone, and then the infrahyoid muscles, often referred to as the strap muscles of the neck, and those are muscles where the site is below the hyoid bone or inferior to it. If we take a look at some drawings here, we can see this drawing right here summarizes the key suprahyoid muscles. We're just going to briefly talk about them. We don't need to spend a huge amount of time other than to recognize as a muscle group they tend to pull that larynx either up and forward or up and back. Now, it's pulled up and forward by a trio of muscles here. We're going to talk about this muscle called the digastric muscle that has a muscle belly that attaches to the underside of the mandible, and therefore when it contracts it can pull the hyolaryngeal complex up and forward. But it also has a second belly that extends back posteriorly, so it also can pull backward, at least that belly of it, and it attaches to the mastoid process of the skull. That's the anterior and posterior belly of digastric. There's a second muscle that attaches posteriorly, and that is stylohyoid here, and that tends to attach the hyoid bone to the styloid process and can pull things up and backward. And then there are another two muscles that are responsible for helping pull the larynx up and forward. One is a muscle called the mylohyoid, which has a broad attachment all along the inferior margin of the mandible. It's kind of fan-like, and then the fibers insert onto down onto the hyoid bone here, and therefore can pull up. It actually forms the floor of the mouth. And just deep to that, what you can't see, is another pair of more belt-like muscles on the midline called the geniohyoid muscles that attach the hyoid to small points or genial tuberosities on the inside surface of the mandible. So that is the summary of the suprahyoid muscles. We also have a number of infrahyoid muscles. We have one muscle here that runs from the hyoid bone down to the superior surface of the sternum. That is sternohyoid. There's the one on the left and on the right. And then we also have a muscle called omohyoid, also a dual-bellied muscle, where it attaches from the hyoid down and then bends back and attaches to the scapula. Those both form two of the three strap muscles of the neck. Then finally we have what are referred to as the extrinsic muscles of the which we have thyrohyoid, which runs from the thyroid lamina to the hyoid here and here. Generally kind of squeezes the hyoid and thyroid together, and then sternothyroid, which runs from the thyroid lamina down to the sternum again. Just as we had a sternohyoid, we have a sternothyroid. And so all of those strap muscles tend to pull down on the larynx. So it's really a tension between the supra and infrahyoid muscles that determines the location of the larynx in the neck. During swallowing, for example, the larynx rises under the tongue, and therefore the suprahyoid muscles are quite active. The strap muscles of the neck are innervated by a complex of nerves referred to as the ansa cervicalis. And I bring this up because this has clinical relevance. Omohyoid, sternohyoid, and sternothyroid are all innervated by this ansa cervicalis, which has roots in the first, second, and third cervical nerves, which form this loop down in the neck, and we can see it here in this image, and it innervates those muscles. Now, that probably wouldn't be that necessary for you to know this, with the exception of the fact that sometimes when we have damaged nerves to the larynx, for example, damage to the recurrent laryngeal nerve, surgeons will attempt to reinnervate those intrinsic muscles, and one of the common nerves that they use to anastomose or reconnect to those muscles, intrinsic muscles, is the ansa cervicalis. So sometimes this takes on a new duty, and surgeons take portions of this nerve and attach it then to regions or parts of vagus nerve 10, cranial nerve 10, those laryngeal nerves, to try and reinnervate the larynx. Finally, I want to just briefly talk about the layered structure of the vocal fold. The vocal fold vibrates, and primarily the reason that it vibrates is it has a very complicated anatomical structure. If you were to take and cut through the vocal folds and look at them in cross-section, you would see something that looks roughly like this drawing here. And what you see is that there's a number of tissue layers. Starting most superficially, you have what's referred to as the epithelium, which covers the vocal fold, and then a number of connective tissue layers here, and then finally that deepest region, which is the muscle, the thyroretinoid muscle. Organizationally, it looks something like this. We have the epithelium, and then as we go a little bit deeper, we have a complex connective tissue layer, a superficial layer, which is primarily loose, gelatinous kind of connective tissue, followed by an intermediate layer that has a lot of elastin in it, so it's fairly stretchy, followed by a deep layer, which has collagen fibers, which is very firm and not very stretchy. And then as we go deeper again, we're into what's called the thyroretinoid muscle. Now, we organize these in a lot of different ways. The intermediate and the deep layer are often referred to as the vocal ligament, which we'd mentioned earlier. All three connective tissue layers are collectively referred to as the lamina propria. Functionally, we often think about the epithelium and the superficial layer and contrast that with these deeper layers and call this the cover of the vocal fold and this the body. Because the cover can actually vibrate relatively independent of the body. This layered structure is critical to normal vocal fold vibration, and damage to these structures can inhibit vibration when the layers are disrupted. That ends the anatomy review. It's by no means comprehensive, but will give you a sense of the kinds of material that would be helpful for you in the course. Thanks.